purpose of the assessment is to explore and discuss biomechanics and musculoskeletal components in swimming, and then in more detail in the swimming stroke of breaststroke, with a focus on how the skeletal, articular, and muscular systems contribute to effective performances. The assignment then highlights a certain injury that can be sustained from breaststroke and discusses the causes, anatomical implications, and possible prevention methods. Swimming engages a range of muscles, joints, and bones, each playing a specific role in executing several swimming strokes, including freestyle, breaststroke, backstroke, and butterfly. Some musculoskeletal components in swimming include the shoulder complex, upper limb, core muscles, lower limb, hip complex, and the spinal column. Each stroke has a specific sports technique to optimize the performance, improve their times, and reduce the risk of injury. Swimmers must maintain a good body position and streamline while in the pool to reduce drag and allow the swimmer to move more effectively. To do this, swimmers' core muscles, including the rectus abdominis, obliques, and transverse abdominis, stabilize the trunk and become involved and maintain the streamlined body position. The erector spinal muscles in the back support spinal alignment and the rotation essential for effective strokes. Swimmers must also have a breathing technique as it is crucial for maintaining oxygen flow to the muscles without disrupting the swimmer's rhythm or body position. It is important to time the breathing with arm movements and maintain a stable core to avoid excessive head movements that could disrupt the streamlining. Another important sports technique for a swimmer is arm stroke mechanics, which includes the shoulder complex and the upper limb. The shoulder complex consists of the bones named clavicle, scapula, and humerus, acting as connectors for arm and shoulder movements. The muscles in the shoulder complex area are the rotator cuff muscles, supraspinatus, infraspinatus, teres minor, and subscapularis, which help stabilize the shoulder joint. The deltoid, pectoralis major, and latissimus dorsi are primary movers during arm strokes, particularly in freestyle and butterfly. The upper limb includes the humerus, ulna, and radius, and muscles such as biceps brachii, the triceps brachii, which relate to flexion and extension, which is crucial for the pull phase in each stroke. The kick technique is also vital for swimmers, as it propels swimmers forward in the water, improves stability and improves body position, minimizes drag, is essential for competitive swimming, and offers speed and impeccable technique. The musculoskeletal component of this key technique is the lower limb, which consists of the femur, tibia, fibula, and pelvis. Some muscles involved with the swimming stroke in the lower limb body area include the quadriceps, hamstrings, and gluteal muscles, which drive the kick particularly in flutter and dolphin kicks. The gastrocnemius and soleus in the calf, along with the tibialis anterior, contribute to ankle flexion and extension, optimizing foot position for propulsion. Another musculoskeletal component is the hip complex, which is made up of the pelvis and femur. The muscles in this body area that contribute to swimming include the iliopsoas, gluteus maximus, and abductors/adductors, which control leg movement and alignment during kicks, contributing to stroke efficiency and propulsion. If you can ace starts and turns in any swimming stroke, it is also vital to completing the technique well, as starts give swimmers an advantage early. The goal of a start is to enter the water cleanly with minimal splash and maintain a streamlined position. Turns help swimmers, as an efficient turn will help maintain speed from one direction in the pool to the other. Timing and coordination is also important for swimmers, as synchronization between each body part is vital for maintaining rhythm and efficiency. The final swimming technique includes mental focus and strategy, which is important as it helps swimmers maintain technique under fatigue and strategize race tactics.
Breaststroke requires the swimmer to perform coordinated patterns of movement that utilize the body's skeletal, articular, and muscular system structures, each having a specific role in performing the stroke. The skeletal system has various involvements in the stroke, including the shoulder girdle, which contains the clavicle, scapula, and humerus, providing attachment points for muscles, enabling shoulder and arm movements. The vertebral column is used to stabilize the body and maintain posture in the water. Also, the pelvic girdle and femur, which play a critical role in the kicking motion, providing leverage for propulsion. The articular system of the body is involved in the stroke as well. Some of the key joints involved include the shoulder or glenohumeral joint, which is responsible for the circular arm motion. This is a ball and socket joint, and as such, it makes a wide range of motion available, which is needed for the sweep in the pull phase. The elbow joint allows flexion and extension during the stroke in the transition from the pull to recovery phase. For the frog kick motion, the hip joint is required, and it is also a ball and socket joint. The muscular system has numerous key muscles involved in breaststroke. These include the pectoralis major and minor, which are crucial for the inward sweep of the arms during the pull phase. The latissimus dorsi, which provides power in the downward and inward pull of the stroke. Other muscles involved in the stroke include the deltoids, which assist in shoulder flexion and abduction during the stroke, the triceps and brachii, which allow for the flexion and extension of the elbow joint, and the gluteus maximus, which stabilizes the pelvis during the leg kick. The quadriceps and hamstrings, which are active in knee flexion and extension during the kick, are also involved as well as the adductors, which are important for the inward sweeping motion of the legs in the kick phase, and gastrocnemius and soleus, which contribute to the plantar flexion required at the ankle joint. During breaststroke, the phases involve various muscles, bones, and joints. The first phase that is performed is the catch phase. The bones involved in this phase are the scapula, clavicle, humerus, radius, and ulna. The muscles involved are the pectoralis major and minor, adduction, the serradius anterior, and the latissimus dorsi. The joints involved are the glenohumeral joint, shoulder flexion and internal rotation, and the elbow joint, slight flexion. The anatomical action of this phase is the arms begin to extend forward, the scapulae rotate, and the hands face outward as they prepare to initiate the outward sweep. The shoulder muscles, particularly the pectoralis major and latissimus dorsi, engage to stabilize the shoulder joint. The second phase is the pull phase, which involves the humerus, radius, and ulnar bones. The muscles involved are biceps brachii, elbow flexion, the latissimus dorsi, shoulder adduction, deltoids, shoulder abduction, and the triceps brachii, extension during final part of the pull. The joints involved in this phase are the glenohumeral joint, shoulder extension and adduction, and elbow joint, flexion to extension. The anatomical action of this phase is the arms sweep outward and downward, then inward toward the chest in a circular motion. The elbows flex while the shoulders perform adduction and slight internal rotation. This phase provides a significant portion of propulsion. Phase 3 is the recovery phase. This involves the humerus, radius, ulna, and scapula. The muscles involved in this phase are the trapezius and rhomboids, scapular retraction, deltoids, shoulder abduction, triceps brachii, elbow extension. The joints involved are the glenohumeral joint, shoulder abduction and external rotation, and the elbow joint, extension. The anatomical action in this phase is after the inward sweep, the arms recover by extending forward, ready for the next stroke. The scapula retracts while the shoulder and elbow extend. The final phase is the kick phase, which has the femur, tibia, fibula, and pelvis bones involved. The muscles involved are the gluteus maximus and medius, hip extension, quadriceps, knee extension, hamstrings, knee flexion, adductors, hip abduction, gastrocnemius and soleus, plantar flexion. The joints involved are the hip joint, extension and adduction, knee joint, flexion to extension, and ankle joint, plantar flexion. The anatomical action of this phase is the legs perform a whip-like movement, starting with flexion at the knees and outward rotation of the hips, followed by forceful adduction and extension. This action provides the primary propulsion during the kick phase. An injury that can occur performing this stroke is a breaststroker's knee or medial collateral ligament strain. This injury is a common overuse injury that involves strain or inflammation of the medial collateral ligament, which runs along the inner side of the knee, providing stability by resisting inward valgus forces. There are various anatomical structures involved in this injury. The adductors muscles are used, including the adductor longus, adductor brevis, and adductor magnus, which play a crucial role in the hip adduction that is central to the breaststroke kick. The quadriceps and hamstrings work antagonistically during knee flexion and extension, contributing to the stability and power generation during the kick. Breaststroker's knee typically develops due to repetitive valgus loading during the kick phase, as the legs sweep outward and then snap inward with force. The knee experiences rotational and lateral stresses. The medial collateral ligament is strained as it stabilizes the knee during inward drive. Over time, these microtraumas accumulate, leading to inflammation, ligament thickening, and pain. The cause of this injury can be put down to improper technique, particularly excessive hip rotation and excessive force in the inward sweep, which significantly heightens the risk of strain. An analysis of swimmer biomechanics indicates that a smoother, less abrupt inward sweep reduces the valgus forces acting on the knee, lowering injury risk. This injury is most likely to occur during the kick phase, where the combination of hip external rotation, knee flexion, and sudden adduction puts the MCL under significant strain. The transition from the outward sweep to the inward whip is critical, as it subjects the knee to high valgus forces. Treatment for this injury can involve initial rest to reduce inflammation, followed by targeted physiotherapy. Strengthening exercises for the hip abductors and adductors are crucial and is correcting any biomechanical faults in the swimmer's technique. To prevent this injury, the swimmer can focus on technique, particularly by ensuring the hips lead the movement rather than relying on the knee-driven force.